45,000 Americans die every year as a direct consequence of lacking health insurance coverage, according to a 2009 study by Harvard Medical School. And a 2019 Gallup poll found that 25% of Americans say they or a family member delayed treatment of a serious illness because of high costs of health care. These are grim statistics for a country that spends more on health care than any other developed nation in the world. What is the cause of this needless suffering and death in such a wealthy nation? Let's find out. The root of the problem is the private health insurance system in America. Unlike other developed countries, the U.S. lets for-profit private health insurance companies be the decision maker when it comes to paying for patients' medical treatment. This leads to disastrous outcomes for patients in this country. The first major problem is the lack of coverage of millions of Americans. In 2018, according to the Census Bureau, 27.5 million Americans were uninsured. These Americans are at risk of serious illness or early death because the high cost of out-of-pocket health care is prohibitive. This leads to the second major problem with private insurance, the cost. Despite millions of Americans needing health coverage, they cannot afford the monthly premiums. The third problem is that health coverage does not guarantee access to life-saving medical treatment. With insurance companies in control, they are able to choose which medical treatments patients are able to receive. Health decisions should be made by patients and their doctors, not private corporations with profit in mind. Even if you are covered by insurance, it does not guarantee that you will receive necessary medical treatment at a reasonable cost. What can we do to take medical decisions out of the hands of these corporations? There is a solution. The solution is a single-payer healthcare system in America. A single-payer healthcare system is where a single entity like the federal government collects and pays for healthcare of the entire populace of a country. This is different from the multi-payer system that we currently have, where a number of private insurance companies collect and pay for healthcare. A single-payer system would solve most of the problems of our current healthcare system. First off, everyone in America would be immediately covered. There would no longer be millions of uninsured. The newly covered would be granted access to previously unaffordable health care that could save their lives. Another benefit would be the lowering and elimination of certain costs associated with health care. If government acted as a single payer of health care costs, insurance premiums could be eliminated. Also, the federal government could negotiate with pharmaceutical companies to keep prices down. Additionally, any needed healthcare treatment would be automatically covered under a single-payer plan. There would be no profit motive involved in the process of deciding what medical care was necessary. The health of the patient would be paramount. All of these benefits of a single-payer system sound pretty good. Let's take a look at what society might be like if it was instituted. Imagine a world where you could go to the doctor and the hassle has been largely eliminated. You can pick any doctor you want and know that you are covered. When you leave the doctor's office, there will be no more surprise bills or haggling with the insurance company. In fact, there will be no more medical bills at all. All necessary treatment will be covered under the National Single-Payer Plan. Medical bankruptcy will become a thing of the past. This sounds like the kind of world I want to live in. How do we get there? We need to take action as citizens to make this dream come true. The first act we can take is to vote. This seems simple, but not enough of us follow through to make our voices heard. Our policy makers pay attention to votes and as our most effective tool for bringing about the kind of society we want to see. The second action is to contact your local congressperson. Our system of government depends on our representatives responding to their constituents' concerns. Let your congressperson know how you feel about improving our healthcare system. Lastly, talk to your community. This might be the most important action we can take. Friends and family members will respond best to people they know personally. People are much more likely to take seriously the opinions of someone they care about versus a politician. These actions may seem small at first, but they can add up over time and could be the key to bringing positive and lasting change to our healthcare system. We would all be happier and healthier for it.